It is 10 o'clock at night. You are on your knees on the kitchen floor watching your dog chew his own paw raw for the 4th time this week. You have already changed his food twice. You have already spent money on a shampoo that promised to help. Nothing has worked. Then you hear it again, that wet, frantic licking sound coming from under the table, and your stomach just drops. I know exactly how exhausting this is. You are not imagining it. This is not just a phase. Between the vet visits that can run $80 or more just to be told to try a new food, and the hours spent, Googling symptoms at midnight, food allergies in dogs are one of the most frustrating problems a pet parent can face. And what's worse, even when you switch foods, the itching often comes right back within days because most people are treating the wrong thing entirely. But what if I told you that you do not need a $400 allergy panel to get your first real answer? What if I told you there is a simple 2-minute test you can do tonight, using nothing but your own 2 hands and a notepad that vets actually use as the very first step before ordering anything expensive? Today, I am going to show you exactly how to tell in one sitting whether what you are dealing with is a true food allergy or something else entirely that is much easier to fix. Hi everyone, I'm Dr. Marcus, your neighborhood veterinarian, and welcome back to the channel. If you're new here, I dedicate this entire channel to helping you become the best pet parent you can possibly be, using simple, vet-approved methods you can do at home before you ever have to step into a clinic. Before we dive in, I want you to drop the guilt. You are not a bad pet parent because you haven't figured this out yet. Food allergies are genuinely one of the trickiest things in veterinary medicine to pin down, and the fact that you are sitting here, watching this video, taking notes, trying to understand your dog instead of just guessing that alone proves how much you care. I actually posted a video a few weeks back on environmental allergies versus food allergies, which I'll link at the end because the two get confused constantly. So today we are doing a complete masterclass on testing for food allergies at home. Grab a notebook because I am about to give you 6 proven steps to figure out exactly what is going on with your dog's body before you spend a single extra dollar. Let's get into it. Chapter 1. I call this the 3-spot itch map, and it is not just checking where your dog is scratching. It is mapping out a very specific pattern that separates a food reaction from almost everything else. Here's what's truly fascinating. Most owners assume itching is itching wherever it shows up, but the location tells a story. A flea allergy almost always shows up at the base of the tail, the lower back, and the back of the thighs. A true food allergy behaves completely differently. It concentrates on the ears, the paws, the armpits, the groin, and around the muzzle.
Ow.
Tonight, sit with your dog and gently run your hands over these 5 zones. Know which ones are red, warm, or thickened compared to the rest of the body. If 3 or more of those specific zones are inflamed and the tail base is relatively normal, that pattern points strongly toward a food-driven reaction rather than fleas or seasonal pollen. Here's your warning though, this is a pattern check, not a diagnosis. Ear infections can also come from yeast, mites, or water trapped after a bath, so don't panic if you find inflammation in just one spot. We are looking for a cluster, not a single symptom. I had a family bring in a golden retriever a few months back. Absolutely convinced it was a shampoo problem because the itching started right after a bath. But when we mapped it out together, 3 of those 5 zones lit up, and the tail base was completely clear. That mismatch between what the owner assumed and what the pattern actually showed was the first clue that led us to the real answer. Your dog's body is quietly giving you information every single day. This map is just teaching you how to read it. Chapter 2 is what I call the kitchen elimination trial. And let me guess, you're probably thinking this means an expensive prescription diet. It doesn't have to. The real science here is simple. Food allergies happen because your dog's immune system has built up a reaction to a specific protein it has eaten many times before. Most commonly chicken, beef, dairy, or wheat. So the test is to remove the guesswork. 7 to 10 days, feed your dog exactly one protein your dog has never eaten before. Think rabbit. Venison or plain white fish cooked simply, with one single carbohydrate like plain white rice or potato, and absolutely nothing else. No treats, no table scraps, no flavored medications. I promise you, this single step eliminates more variables than any shampoo or supplement ever could. If the itching visibly drops by 50% or more within that window, you have your answer. This is very likely food-related. Now, here's a quick warning. Never attempt this with a puppy under 6 months. A senior dog with kidney or liver disease, or a dog on strict medication timing without checking with your vet first, because nutritional balance matters even during a short trial. Here's what's truly fascinating about why this works so well. Chicken is actually the single most common trigger we see in clinic. Not because it's a bad ingredient, but simply because it's in nearly every commercial dog food on the shelf. So dogs are exposed to it constantly, year after year, until the immune system starts overreacting. That's why swapping from one chicken-based food to another chicken-based food with a different brand name almost never solves anything. Even though it feels like you're trying something new, true novelty is the whole point of this test. Chapter 3 is the stool consistency log, and stick with me here because this one gets overlooked constantly. What if I told you your dog's stool is actually one of the earliest food allergy indicators, often showing up before the skin does? The science is straightforward. When the gut lining reacts to an allergen, it becomes inflamed, and that inflammation shows up as soft stool. Increased frequency or visible mucus, sometimes weeks before you notice serious itching. For 5 days, simply jot down a 1 to 5 rating each time your dog goes, 1 being firm and formed, 5 being watery. Alongside that, note the time since the last meal. If you consistently see a 3 or higher within a few hours of eating a specific food, that food is a prime suspect. The warning here is simple. Occasional soft stool from stress or a new treat is normal. We are looking for a repeating pattern tied to meals, not a one-off. Chapter 4. And this is my personal favorite because it actually helps your dog feel better while you're still figuring things out. It's not just tea. It's the tannic acid and natural compounds in green tea that gently constrict inflamed blood. Vessels right at the surface of the skin, calming redness almost on contact. While you're running your elimination trial, brew 1 plain green tea bag in a cup of hot water. Let it cool completely, then soak a clean washcloth in it and press it gently against the paws or ear flaps for about 5 minutes. Once or twice a day, it won't cure the allergy, but it takes the edge off the itching while you wait for the real answer. Now, here's a quick warning. Always let the compress cool to room temperature before applying it. Never use it on open wounds or broken skin, and stop immediately if you notice any new irritation. Chapter 5, and this one surprises almost every pet parent I show it to. It's not just a flower. Calendula, which comes from the marigold plant, contains compounds that some studies have shown produce anti-inflammatory effects comparable to mild over-the-counter hydrocortisone creams without the same absorption risks through the skin. Look for an alcohol-free calendula tincture made for topical use, diluted about 1 part tincture to 10 parts water. And dab it gently onto irritated paw pads or belly skin with a cotton ball, once daily. Here's your warning. Always do a small patch test on a quarter-sized area first and wait 24 hours. Since some dogs can be sensitive to plant-based tinctures, and never use it near the eyes. Chapter 6 brings us back to the foundation because none of this works long-term without it. Once you've identified a likely trigger through your elimination trial and your logs, the real fix is consistency. Feeding a diet built around that safe, novel protein. Supporting the skin barrier from the inside with a fish oil supplement rich in omega-3 fatty acids. Studies consistently show reduce overall skin inflammation over 4 to 6 weeks of daily use. Ask your vet for a dosage based on your dog's exact weight because too much fish oil can cause loose stool or interfere with blood clotting in dogs already on certain medications. Chapter 7. And I promise you this is the piece almost nobody talks about, the 21-day rule. Even after you switch to the right food, the immune system doesn't calm down overnight. Old inflammatory proteins are still cycling out of your dog's system, and the gut lining needs time to repair itself. Most owners quit a food trial at day 5 or 6 because they don't see instant results. They jump to a different food, which resets the whole clock. Stick with a genuinely novel diet for a full 21 days before you judge whether it's working. If you're keeping your itch map and your stool log during that window, you'll actually be able to see the trend line improving, even on the days it doesn't feel like it. Now, please listen closely, because this is a massive veterinary warning. None of these home tests replace an actual visit to your veterinarian if your dog is losing hair in patches, is developing open sores, running a fever, vomiting repeatedly, or showing any swelling around the face or throat. Those symptoms can signal a severe allergic reaction, a secondary infection, or something more serious than a standard food sensitivity, and they need to be seen the same day. Home testing is your first step to understanding your dog, never your last step in caring for them. Here is the golden rule going forward. You do not need to do all of this at once. Daily. Keep up the simple stuff, the novel protein diet, and a quick glance at those 3 itch zones while you pet your dog. 2 to 3 times a week. Jot a quick note in your stool log and apply the green tea compress if your dog seems uncomfortable. As needed during a flare-up, bring in the calendula spot treatment. The whole process should take you no more than 10 minutes a day. Figuring out a food allergy is one of the hardest parts of being a pet parent, because your dog can't just tell you what's wrong. But by choosing to educate yourself, by choosing to sit on that kitchen floor and actually map out the pattern instead of guessing, you are proving how much you truly love your dog, and that makes you an incredible pet parent. If this video gave you a plan to finally figure out what's going on with your dog, please hit that like button. It helps more pet parents find this information when they need it most. Subscribe and hit the bell so you never miss our weekly deep dives. Please leave a comment telling me where on your dog's body does the itching show up the most. I read every single one. Give your sweet, beautiful dog a gentle scratch behind the ears for Dr. Marcus tonight. I'll see you in the next one.